Good morning, everyone, and welcome back to this week's episode of Fresh Future Fridays. I am Tamazha, and I am the store manager of Fresh Future Farm in North Charleston, South Carolina. My background is in public health, so I've kind of been informing you all about the COVID-19 pandemic these last few months, and kind of wanted to do a refresher today and kind of give you some ideas on how you can de-stress your mind and body when we're just saturated with all of this information, and a lot of it isn't good information, but just trying to stay sane and buckle up, because apparently we are on, the verge of a second wave of this. So I have my outline here once again. If I keep looking down, that's what I'm looking at, and let's get into it. So as a reminder, COVID-19 does still exist. Recently I have seen a lot of posts and accusations that it was a lie. It is not. It's a very real pandemic, and millions of people have been affected by it. Even those who have not been diagnosed with it, may know family members, or just having to change the format of your life and your daily routine. Like, all of us have been impacted by it in some way. So although sorry, there was a big truck rolling by. Although our national message and our focus right now is on social justice and receiving justice for Black people who have been murdered by the police and former police officers, including Ahmaud Arbery, Breonna Taylor, and George Floyd, that's been our focus, and we have been demanding justice as a nation and beyond for these people, but COVID-19 is still very real, is still very here, and I just want folks to recognize that. So it is imperative that you take that into consideration as you live, work, and play. I know here in South Carolina, our state's been open for a little under a month, and people have been going back to complete normal, and it's not complete normal, and that's not okay. So just a quick refresher, the United States has reported over 2 million cases. Over 2 million people in this country have had or do have COVID-19, and that's a lot of people. And to put that into perspective for everyone, we do have about 7 million cases worldwide. So we're a good percentage of that, and I just wanted to bring that to everyone's attention. In South Carolina, we've recently reported almost 700 cases in one day, yesterday. And so I just I'm putting these numbers out there to give everyone a reality check, and to remind you all that you should still be practicing the CDC's recommendation despite the fact that our governor has reopened the state, especially in South Carolina. So as a reminder, social distance, remember to stay at least 6 feet apart from people, especially in public whenever you're out doing your shopping and things like that. You just want to make sure you're not on top of people. I've had people seem like they intentionally tried to come into my space. Don't do that. That's kind of rude, especially you never know what type of underlying conditions someone may have that can make them more vulnerable. So just be mindful of your personal space. I've had to check myself sometimes too, standing too close to people in line. Luckily they have been putting markers on the floor, which is very helpful. So just be mindful of that. A lot of stores have arrows down their aisles, so you know that it's a one-way. Be mindful of that. I've seen a lot of people not even caring about that. So I know it seems like a lot, but just trying to be mindful of not being on top of people, even though that is our initial norm. Next, wearing a mask. The CDC recommends a cloth mask covering over your mouth and nose when you're in public. I've also seen a lot of people not abiding by this, and trust me, I hate it, but it's very necessary, especially now that the summer months are here, and in Charleston, it's hot. So wearing a mask is very I feel like it's a lot of labored breathing, and it makes you tired, and it's definitely uncomfortable, but is very necessary. And if you stay home as much as you can, you don't have to wear a mask all the time. So that's the next one, is staying home as much as possible. I know we've been doing this for months now, and everyone's probably stir crazy. I know I have been, but it's kind of like picking your battles at that moment. Do you want to risk infection or getting someone else infected, or could you just skip the brunch date or the lunch date or whatever? So that's something else to do. And then last but not least, this was the initial like tagline of COVID-19, is wash your hands, wash your hands, wash your hands, sanitize and wash your hands, sanitize and wash everything at this point, just to be on the safe side. But yes, so I know with all of that being said, it's kind of annoying and redundant, but I feel like in my close circle and friends on social media, I personally have been seeing a lot of, just dismissing those guidelines, and it's hard, like I said, but necessary. And so I just want to encourage you all and affirm you that you can do it. It feels impossible, and some days are harder than others, but it's doable. This isn't going to be our forever, but it is our now, and so we definitely have to take that into account. And then another way to just keep your spirits up is just, look for that light at the end of the tunnel. There are vaccines that are being created. They're working towards, being able to help us better, but we have to be patient and we have to acknowledge that. So now let's talk mental health. I feel like this is probably something that has, caused a lot of distress for many folks, whether you can't receive the health care that you need, you're tired of staying at home by yourself, you feel isolated and lonely, you know someone who may be impacted by it and you don't feel like there's much you can do. But I just want to encourage you to take care of yourself first. Especially your mind. The mind is very, very smart, and it works without us even being aware of it. So we can get into these ruts and feeling like, you don't have many other options, you're sad, you don't want to do much, but then you do at the same time, like all these conflicting feelings. And so I just want to give you all some ways to acknowledge that you're feeling that way, and then how to kind of cope with it and manage it if you don't have access to someone who can, guide you on some mental health rehabilitation. So some signs that you could be down in the dumps are just an overall feeling of sadness. You can change your sleeping and eating habits. You're not sleeping, you don't want to eat. Another truck, sorry. You're not sleeping, you don't want to eat, you don't want to do anything, you're sleeping too much. If you've seen some drastic changes in your normal patterns of how you live and show up in your days, then that could be like a sign that it's time to take a minute and assess how you're feeling, and try and use some of these tactics to get you back to your normal. So the first thing that's helped me significantly is unplugging, which is very hard, especially I'm 22, so social media is my jam, but it's saturated with so much information, some right, some wrong, and at some point you just have to cut it off, take that negativity away. And it's hard because you want to stay engaged and you want to be aware, but at some point, at what point do you compromise yourself for that? And it should be no point, but it happens. And so I would encourage everyone to start with 20 minutes of no social media time. If you're on there all the time, or no TV, and just sit with your breath, just breathe and like meditate. Think of the things that bring you joy. Imagine some place that makes you happy. Just take that time to not be looking at a screen and to, be with yourself instead of trying to be with the masses. Next, I would encourage you to try and get active, move around. I've been going on some walks here and there. It was more consistent. I've been kind of falling off lately, but just walking around the neighborhood for a few minutes just to get outside, get some fresh air has been so helpful for me. And although I'm not going anywhere, it still feels like I've gone on an outing, so I feel like that's helpful for me. And then try some other activities or hobbies that you may have been putting on the back burner. If there's things that you've been interested in doing and you never had time to, and there's some time in your schedule now, I would encourage you to go ahead and, try it out. I've been doing a lot of reading, both fiction and nonfiction, trying to keep a balance with that. I've been doing some journaling, listening to podcasts, which is still some type of media, but I feel like it's not a screen, so that's more helpful, and I'll take notes just so I can get back in that action of writing and not typing and everything all the time. Board games, cards, I've been gardening. There's things to do other than be on your phone all day. Even if it's a small break, I would encourage you to go ahead and take that. So with that being said, I challenge everyone this week and the next coming week to take some time for themselves, unplug from the media and all of that. And then in the comments below, let me know how you're going to take care of your mental health. I hope you all enjoyed this video, and please don't forget that if you're interested in donating to Fresh Future Farm, the link is in our bio on Instagram. And we will see you next week. Thanks for watching. Bye.